Thank you, Chairman Banks and Ranking Member Kim, for the hearing. My district in Nevada covers almost 50,000 square miles, includes both one of the fastest growing housing markets in the country and in rural communities. It's also home to Nellis Air Force Base with more than 11,000 military members that must compete for critical services in a rapidly growing district, and at Creech Air Force Base, also in my district, which has 3,500 service members who lack access to critical services at their duty location and must travel 100 miles a day in order to access childcare, military housing, and healthcare services. Access to safe, secure, and affordable housing is a concern of many of our constituents. As recruits consider military service, the availability and affordability of adequate housing is a concern. Nellis Air Force Base is among the installations with the highest levels of unmet housing need. This time last year, that unmet housing need meant that young airmen were being released into off-base community housing after 11 months. It concerns me that since then, the issue has only worsened, with airmen now being released after only 8 months. Lieutenant General Miller, I don't have to tell you that 8 months is very short of the Air Force's requirement of 36 months time in service. So I'll ask you the same question I asked Secretary Kendall and General Alvin earlier today, but I want to ask you, can you speak to the importance of ensuring adequate housing availability for both recruitment and retention of military members, and what is currently being done to address the needs of our young unaccompanied airmen at installations such as Nellis?
Yes, Congressman, thank you. And I will tell you that housing is absolutely a readiness issue. It is a quality of life that we have to make sure that we have safe and quality housing. So at Nellis in particular, we just did a $4.5 million dorm renovation. We also have 2 projects coming up for Milcon that are in design to do that. We're partnering with the community to find additional housing. We know that Creech is a continual challenge because of the distance, and so we're looking at all sorts of opportunities to get childcare out there, do busing, and so that is a big focus item for us.
Okay. Well, at the Nellis issue and those investments, I'm proud to have worked with this committee to secure. The problem is that's to replace other housing that's coming off. So it's not really in addition to, it's in place of. And so we really need a larger commitment to housing in these unmet areas if we're going to address the recruitment and retention issue. On the Creech side of the equation, I look forward to partnering with you. I've identified a number of opportunities in partnership with the local YMCA and other child care providers in and near Creech Air Force Base. Let me turn to another issue around health care, which is also a critical piece of the support that we need to provide to military members throughout their careers. For members at Creech Air Force Base, many airmen must travel to Nellis Air Force Base, as I said, to receive specialty health care, resulting in months-long wait times and increased cost. Additionally, the transition of the services health care to the Defense Health Agency has resulted in many members having increased concerns with their access to medical care. So to the panel, can you speak to the impact that the changes to the military health care system are having on our ability to recruit and retain top talent?
Representative Horsford, I think we're in a very competitive environment with a nationwide shortage of providers. So in conjunction with the Office of our Surgeon General and DHA, we're taking on this challenge. It's very serious, and we acknowledge absolutely we need to take care of our soldiers and families and continue to work forward on this.
Sir, I travel often in my role, and this is, darn near the #1 concern I hear from family members. So, similar to my Army counterpart, our Surgeon General works closely with DHA. As SecNev testified yesterday, we're willing to take risk in short term with the operational medical forces as we cover down with DHA to make sure we're, addressing these things appropriately. But, underinvestment and under execution need to be addressed, and we look forward to moving out together with DHA.
I know we're out of time. I want to thank our witnesses for being here. These are critically important issues. Thank you for your service, and I look forward to having my office follow up with you. With that, I yield back.